Chinese health officials reported 45 new deaths, bringing the number of those killed in China to 304. Crucially, though, more than 14,000 people are confirmed to have the illness.
The DOH also confirmed that the 44-year-old male died yesterday, February 1, 2020. Over the course of the patient's admission, he developed severe pneumonia. In his last few days, the patient was stable and showed signs of improvement. However, the condition of the patient deteriorated within the last 24 hours, resulting in his demise.
Meanwhile, Chinese authorities have stepped up their efforts to fight the spread of the virus. The eastern city of Wenzhou has become the first outside of the epicenter of Hubei province to go into virtual lockdown. Some 800 kilometers from Wuhan, people in Wenzhou can now go out only once every 2 hours to buy necessities. Public events have been cancelled, schools and museums have been closed. More than 250 people in the city actually have the coronavirus now. Right, we've got Wayne Hay in Hong Kong to bring us up to date with everything. Let's start with the case in the Philippines, Wayne.
Yes, well, authorities there, the Philippine government and the World Health Organization, in announcing this fatality that took place on Saturday, very keen to stress that this was not a local transmission, that the 44-year-old man from Wuhan, where it's thought that this outbreak first started, brought the virus with him from China. He travelled to the Philippines from China via Hong Kong on the 21st of January. 4 days later was hospitalized and then died on Saturday with severe pneumonia. He didn't travel alone either. He was with a 38-year-old woman, a travelling companion. She is also from Wuhan, and she had earlier been confirmed as the first coronavirus case in the Philippines. So she's being kept in isolation in a hospital in the Philippines. So the confirmation of this fatality coming on Sunday, just hours after the Philippine government had tightened its travel ban to now stipulate that all foreigners travelling from China, including Hong Kong and Macau, not just mainland Chinese citizens, but all foreigners travelling from China to the Philippines are now banned. Previously, it was just citizens from Hubei province. So we're seeing the Philippines following the lead of several other countries now in implementing these sorts of travel bans.
OK, and what about Hong Kong as well? Actually, where are you today? I remember you were outside a pharmacy yesterday. What's happening behind you today?
Well, we are outside a commercial building in Hong Kong. One of the big challenges in this city at the moment is a shortage of face masks. So there is a private company here, a tour company, that has managed to get hold of around 5,000 protective face masks. They're giving them away free. So people have been lining up right around the block to try to get some of those face masks. One thing many people in Hong Kong want is for the government to close the borders between mainland China and Hong Kong. The government is not doing that, so one group, a union representing thousands of medical workers, are going to go on strike beginning on Monday. Initially, they're saying it'll be around 3,000 non-essential medical staff, but they are vowing to increase that action, to step it up as the week progresses if the government does not bow to its demands. One of the key demands is that it prevent mainland Chinese citizens from entering Hong Kong. Again, the Hong Kong government, it doesn't seem likely that it will bow to those demands. They have said repeatedly that they will not close the borders. The chief executive of Hong Kong, Carrie Lam, has said that she favours keeping the borders open for people to travel through and also for trade to continue, instead opting for increased medical checks and things like that at the borders. And that is certainly something that the World Health Organization advocates as well. And yet we are seeing, as I mentioned previously, country after country, member nations of the World Health Organization like New Zealand, Australia, Singapore, the United States, introducing these bans on people travelling from China into their countries.
Thank you, Wayne Hay in Hong Kong. More now on the global response to the crisis, and Wayne has mentioned some of this, the Philippines and New Zealand becoming the latest countries to ban foreign tourists from entering if they have recently visited China. South Korea has banned any foreign nationals who have recently been to Hubei province as well. More airlines have suspended flights to China You've got the US carriers, Delta, United and American, all cancelling services. Also Qatar Airways, Vietnam Airlines and some other Asian carriers. And Russia has said it is suspending all visa-free travel for tourists to and from China. Vietnam's government's also stopped issuing visas to people who have recently been there. Meanwhile, authorities in New York City say they're investigating the first possible case there.
This individual, this patient, who is being evaluated right now, did exactly as they should have, followed the guidelines that the City of New York put out, and they met these specific criteria. They had traveled to China. They did have the specific symptoms associated with coronavirus, and they did come to get medical care here at the hospital.
Well, the investigation in New York comes as the US confirms its 8th case in Boston. Gabriel Elizondo has those details.
There are 3 in the state of California, 2 in Illinois, 1 in the state of Washington, and 1 in the state of Arizona. The latest confirmed case comes from the state of Massachusetts, particularly the city of Boston. That's where officials there said it is a man in his 20s, a college student who is a student at the University of Massachusetts at the Boston campus, who had come back from China, showed signs or symptoms of being sick, was tested, and the test came back positive. He is now being held in isolation at his home in Boston and being closely monitored 24 hours a day by medical officials there. We also have from the city of New York City, the mayor, Bill de Blasio, confirming the first suspected case. The U.S. is preparing potentially for hundreds, if not thousands, of people that they're repatriating from China or visitors that they need to quarantine, and where they're going to put them. Well, the Department of Health and Human Services has requested that the military set up some sort of quarantine areas on military bases, and the Pentagon confirmed that they are doing that. They're having beds, if you will, for as many as 1,000 people to be quarantined. They've already identified 3 different military bases where they will put these people that potentially could have coronavirus should this be necessary in the coming days. All 3 major U.S. airlines, United, American, and Delta, have canceled all of their flights to China. However, there are flights from Chinese carriers that are coming to the U.S. still, and those flights are all being diverted to 7 different international airports in the U.S., where there is going to be extensive extra screening of all passengers who are either coming from China or could have come through China to the U.S. All of this is going to be starting on Sunday.
The thoughts now of Dr. Vin Gupta. He's from the University of Washington Medical Center and says China has responded well to the outbreak, but the virus has proved almost impossible to track.
You know, I have to applaud the Chinese government because I think they've learned the lessons of 2003 with SARS, because coronavirus, this current virus, is behaving very similarly to SARS. It kills elderly individuals more so than younger, otherwise healthy individuals. It seems like it's actually more transmissible than SARS, that if you're asymptomatic or if you're recovering from this illness, you're still likely to transmit it. That's why it's so concerning, and frankly even more concerning than SARS. So I would say the Chinese government has learned the lessons of the past. There are some concerns that maybe they delayed their detection or weren't issuing red flag warnings as soon as they should have, but they've done a lot. And if it's true that if you're an asymptomatic individual, that you can still transmit it, and major studies and major medical journals have confirmed that, then the transmission patterns of coronavirus are unlike anything we've ever seen previously with a droplet or airborne transmitted disease like flu or SARS or MERS. This is different, and this is concerning. That's why our Pentagon and our military services are setting up quarantine beds, because what else are we going to do? But the fact is, you can't quarantine everybody, so I think we should all be prepared that case loads will increase. I think I'm hearing numbers of 75,000 just in Hubei province. We should expect that number. We should expect the number of dead to increase. We should expect the number of suspected cases here confirmed in the United States to increase as well, and I think that should not be surprising to any one of us.